We are going to start with the first of two speakers, hopefully, for our Navigating Mental Health session. And so I want to introduce Jaci Leit, who will introduce herself and tell you a little bit more about her. So I'm going to turn it over to Jaci.
So thank you so much. I told Maria that this actually means a lot to me to be able to speak with you guys. I am a licensed clinical social worker with a private practice in New Jersey, but I'm also the mom of a son with KSS. And when Jared was first diagnosed, there wasn't really a lot of people within the KSS community. So we actually got a lot of support from the LHON community in beginning to understand a lot about his vision loss and how to help him compensate. So this is really wonderful for me, and I will totally earn. I'm actually a little anxious speaking in front of all of you right now, because you guys are all very big in my mind. But with that being said, so my background is clinical social work. Initially, I was doing community mental health or hospital-based mental health, which is where I actually began my interest in working with people with medical conditions. When my son was diagnosed is when I switched into private practice because it was easier to coordinate my own schedule at that point and give me some flexibility. But my heart really still is in working with kind of that community level and making sure that care is accessible to everybody. But so for today's conference, I really just kind of wanted to go from a practical perspective. Now I'm going to put on the reading glasses. So navigating mental health and understanding psychotherapy. These are terms we keep kind of throwing out to you people, but what is mental health and what is psychotherapy? Kind of wanted to just put it into a perspective and make it really basic. So not really going scientific, not really going into the medical, but really looking at kind of what does all this mean and how can you access that kind of care? But in order to do that, we need to kind of start with what is mental health? Because I know often when people think about mental health, you're thinking, bipolar, you're thinking schizophrenia, you're thinking all these major things, or even a major clinical depression, which probably doesn't qualify. And that would then make you think, I don't need to go and talk to anybody for mental health. So I'm going to use the CDC definition for mental health, and I'm going to read it so I get it right. They say mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also determines how we handle our stress, relate to others, and make healthy choices. So that's a pretty broad definition, really kind of covering all aspects of our lives. And I think that's important to consider because when you're dealing with a diagnosis like LHON, it is hitting every aspect of your lives. It is not just the medical component. It is your work component. It is your life. It is your social. It is your activities. Everything is impacted. And keeping that perspective when we're looking at what mental health is. So the idea of psychotherapy, I want to start with what psychotherapy isn't. And I'm going to quote my son on that because I have suggested to my son as a therapist that he should go into therapy. And his reaction to me is, that will not fix the problem, Mom. And he's right. And I told him he's right, which you really shouldn't tell a 19-year-old because he's going to run with it now forever and ever. But he's right. Therapy isn't going to make the diagnosis go away. Therapy isn't going to bring your vision back. Therapy isn't fixing the problems. So what can therapy do? Therapy can help you learn the skills you need to adjust to your circumstances. Therapy can give you support. Therapy can be a place where you can vent where you're feeling not judged, where you don't feel you're burdening a family member or a friend who's kind of like, okay, I don't want to keep talking to you about this, but somebody who can just be there to listen. Therapy can also help you shift perspective because so much of adapting and adjusting is looking at things a little differently. It's so easy to be overwhelmed by all of this at first. And it is overwhelming. I can't tell you it's not. I always say to my clients, I'm never going to tell you, sorry, I'm going to use their word, it sucks. It does. I can't tell you it doesn't. But if we can do things to make it a little different, so it kind of like, I don't play poker, but everyone's knows about bluffing. No one knows what cards you have in your hand. What do you do with the cards in your hand? You can still win the game. That's what therapy can teach you to do. How do you work with what you have at your fingertips? And I do think losing vision is a very unique situation. It is, if you look, it is one of the worst fears. Like if you ask people, what are their fears? Losing vision is the top fear, which makes a lot of sense. We live in a sighted world. We are dependent on our sight. People assume we are dependent. People will look at us and they look at my son. He doesn't look like he can't see. He can't see, but people assume he can. So we're losing one of our five senses. So it is a unique process, and it is a different process than if it is someone who's born without their vision, or even a child who lost their vision when they were younger, and they've already learned adaptive skills. So when you get your diagnosis, when your symptoms first start, not only are you dealing with that acceptance of that diagnosis, that overwhelming, that panic, that fear, all those emotions, you're still dealing with life. You still have your families, you still have your jobs, you still have school. That's not stopping. So all of those things are kind of playing into this huge picture, which then leads me to my next analogy of why mental health is important. So a glass. I'm going to put water into this glass, and it's a perfect glass. It could be a Stanley cup, it could be a mug, I don't care, but it's perfect. Water starts pouring into this glass. And it keeps pouring and pouring and pouring. And now it is overflowing. And now you need to get some paper towels. Or maybe you need to ask somebody to get you another cup. Or maybe you need to find a way to stop that flow of water. But it's not you who's making the water flow. It is some thing in the universe that has decided this is going to keep happening. But it's not the glass's fault that it's overflowing. That's the same with mental health and why there shouldn't be a stigma, especially within this community. We're overflowing. Mental health becomes an issue when a person's capacities are overwhelmed, when our resources are tapped out. So if you have to deal with a medical diagnosis, you have to adjust to loss of vision, figure out your work, figure out your family, figure out your social, figure out your bills, figure out all this stuff. Yeah. Doesn't it make sense that maybe we're going to have some depression, some anxiety, some panic, some fear, some feelings of being overwhelmed? But it's not the cup's fault. And there is so much stigma attached to mental health where, again, like I said, in this population, really challenging that. Mental health services, they're not a bad thing. And again, there is a difference between something like a schizophrenia, bipolar, which are often biological based, versus something that is more circumstantial and situational. So therapy also doesn't have to be an ongoing process. It can be kind of like you touch base. You go, you talk, you get some help, you get some support. Then you could take a break. But if life shifts again, then you go back. But a depression or an anxiety, whether it is biologically based or based on psychological, emotional, or social, or medical, it's just important to treat that. So really kind of working past that idea that I am not mentally ill, that there's not mental illness, that it's a bad thing, but embracing that concept of therapy. So as I was saying before, I think the idea of recognizing with mental health, again, that multifaceted impact of a diagnosis like LHON, because all of those things are fitting into a piece of a puzzle. So we're talking about impact on employment. If you're working, and I'll use a case example, I was working with a woman, she was a nurse in a very busy hospital. She was on one of the busiest floors. She didn't have LHON, she had another genetic disease, another rare one, because why not? And she was losing her vision and she couldn't do her job anymore. All her life, she was a nurse. She was the primary breadwinner. She was a mother. She was responsible for taking her child to and from school and activities. And now she can't drive. She can't work. All of this just started being very overwhelming for her. So even within that story, you hear those levels. So it's impacting her work, her finances. It's impacting her family. It ended up impacting her social. I think a lot of you can relate that feeling of she didn't want to go out. She didn't want to go to church because she didn't want to have to say to somebody, I can't see you. I don't know who you are. And people would wave and say hi. And she was embarrassed and she was ashamed because she didn't know who they were. And rather than saying, I don't know, I don't see you, she chose to not go, which then isolated her, which took away more of her independence and created kind of a spiral in those emotions. But again, all from one diagnosis and from losing her vision, all these things just kind of started like a ripple effect. So that other aspect is the mood. So we talked about those kind of big external kind of concrete work, family, social activities, mood. I think the key thing often when we're dealing with a chronic progressive medical condition is that impact on mood. And when I say mood, it's often a grief process. There is often so many layers of mood within this, and it's different for everybody, and it's going to be different at different times. But recognizing that there is a grief process. And I think it's important when you look for therapists to find a therapist who is trained in grief process, someone who has taken that time to really understand the different theories. But the main theory, which I think does really apply for the LHON community, is the 5 stages of grief. And there is a 6th stage that was added on by David Kessler, and I'll address that in a second. But the interesting thing with the 5 stages of grief is that Dr. Kubler-Ross, she's the one who identified the 5 stages of grief. And most people think that she established this when she was working with a population who had lost like a partner or a loved one. She was actually working with a hospice population. She was working with people who had a chronic or progressive medical disease. And that's when she first noticed they went through denial, anger, bargaining, depression, and acceptance. So that whole concept is really based around living with a medical condition. Thing people have an issue with those 5 stages is people think, oh, cool, I did denial. Okay, I'm going to anger. That would just be too simple. It's like a ping pong ball. It makes no sense. It's all over the place. You could start at anger. You could start at bargaining. You could start at denial. You can think you've gone through all the 5 stages and then something else is going to happen. And again, within this community, we talk about the stresses, that water overflowing. There are going to be life events. Again, to revisit the case study, when her daughter graduated, she was so upset because she couldn't see her get her diploma. And we had to talk about that and process through it. Again, therapy didn't fix that, but it gave her the ability to think about it a little differently and to be able to handle those emotions in that situation. So balancing through those stages, and it is an ongoing process, which is why I use the word process, because I would love to say it stops, but it doesn't. The other concept I like people to think about in terms of grief is also a pendulum theory, because there will be times when it is quiet and maybe we're even going to think, oh, wait, why am I feeling okay? It'll swing, unfortunately, because life happens. But if we know the pendulum is going to swing, we're going to experience those symptoms, we're not going to experience. We're going to, we're not. Then we can be prepared, at least emotionally, and again, have those skills to be able to handle each thing as they come. Now, I asked you to think about that last stage of the grief process. Oh, let me go back for a second. David Kessler created a 6th stage, which was making meaning. So David Kessler was a protege of Dr. Kubler-Ross's. He actually came up with that 6th stage when he lost a child due to a terminal disease. And it was his way. He felt that it didn't just end at acceptance, but kind of how do I move forward? How do I keep living? So he took it a little bit further than that acceptance and brought it to, okay, what's that next step afterwards? But that idea of acceptance, I think, is important when it comes to how do you choose a therapist? Because there are a lot of different therapy modalities. One of the therapy modalities I think works best for a community that is visually impaired and other medical conditions is called acceptance and commitment therapy. And why I think this is actually one of the better approaches is while other approaches are very evidence-based and they're very rigid. So if you're doing pure CBT, cognitive behavioral therapy, it's very usually time restricted. It's like 12 to 20 sessions. You have to commit to it. Interestingly, with CBT, you're often given homework, which is often handouts, which again, if you don't have a therapist that is aware, giving you a handout isn't going to help. I know you give my son a handout. He's like, what am I doing with this? So making sure that your therapist is also aware and that they are following ADA accessibility. But so this idea with acceptance therapy, it's similar to CBT. So it's looking at your cognitions and your emotions and behaviors, but where CBT is a little bit more rigid, and the idea behind it is we're going to challenge irrational thoughts. We're going to challenge our distortions. But what if our distortions aren't distortions? What if you have every right to feel overwhelmed? What if you have every right to feel depressed and angry because everything has changed? You don't want a therapist looking at you go, oh, no, no, you're wrong about that. You shouldn't think that way. You have every right to think that way. And that's what acceptance and commitment therapy allows for. And we're going to call it ACT because that's so much easier than me keep saying acceptance and commitment therapy over and over again. But it allows for, you're allowed to have your feelings. You're allowed to have negative feelings. But instead of suppressing them or shifting them, which is what CBT would do, it's accepting. It's learning how to accept it. So the idea of radical acceptance, and I know when you say the word acceptance, a lot of people are like, I don't want to accept. Because accepting means I'm okay with it. Accepting means I like it. No, I don't expect any of you to like it. Acceptance means what choice do I have? Here's my circumstance. What do I do now? That's radical acceptance. I can't change this aspect. What can I change? And usually the only thing we can change is how we react, how we respond. That's what acceptance and commitment therapy actually can teach you. But it never negates how you feel. It's also a little bit more flexible. So again, maybe you can't commit to all those sessions. This allows you, you can say, you know what, I can come once a month. Okay. Therapist is going to work with you. If the therapist says no, call another therapist, and we'll talk about that after. But it gives you those skills, a different way to think, a different perspective. And that's really what it comes down to. And again, looking at all those pieces, that multifaceted approach, because again, our identity is so tied to all those things that we talked about: vision, our jobs, our family, our social activities. Our identity is also lost, so that grieving process, but how to adjust to that. So I really find that if you find someone who knows both the grief process and ACT, it can really be beneficial. And again, respecting where you're at, not just the therapist saying, this is what I want you to talk about. Both of those also give the flexibility that a lot of people don't want to go into therapy because I don't want to talk about my childhood. I don't need to talk about my childhood. That's not my problem. Okay. Grief therapy and ACT both allow for that. It is not necessarily emotion-based. It is more situational and skills-based. So it allows you to kind of discuss and process what you want when you're ready to do so, which is, again, why I really like it for working with people with medical conditions. But one other piece I want to hit, because I mentioned family, and I'm going to quote my other son on this, because I was trying to convince my other son to see a therapist. You'd really think if parents are therapists, they would see a therapist. But I looked at my little one and I said, I really think you need to talk to somebody. And his response to me was, but I'm not the one with Mito. Jared's the one who's sick. I shouldn't complain. On that one, I did not agree with him. I told him I get what he said. And then I used another analogy. I like my analogies. We're in a car. There's a person driving. There's a person in a passenger seat in the front. There's a person in the back seat. Hopefully there's no one in a trunk. If there's someone in a trunk, I really need to talk to you guys because that's not okay. But we're all in that car. It's a different perspective. We're all on that ride. So my younger son's ride is a little different than my older son's. He may not be living with the disease, but it's impacting him. So family members, loved ones also need support. It's not just the person who is affected. Everyone has their own perspective. And again, they're all just as valid. So I would recommend, again, the same kind of therapist for the loved ones. But again, that idea that I shouldn't need it, no. And also, if we go into therapy as a loved one, hopefully we can also learn ways to support the person that we are with, so that when they are struggling, we can also help them tap into those skills that they're being taught. So with all that in mind, now we have an idea of kind of why to pursue therapy and why mental health is important. Okay, now how do we figure out a therapist? So a lot of people I'm hearing today the word psychology. So I think a lot of times when people think of therapists, we think of psychologists. Okay. There are 4 major types of therapists. So psychologists are probably the ones that most people hear about. So those are people who have PhDs or PsyDs. They have completed a doctorate program. So their program is both clinical and often research oriented. The unique thing about psychologists, they can do psych testing. So if you're in a position where you needed psychological testing or educational testing, they can provide that for you. Otherwise, they can do therapy, kind of the whole thing. There are 3 other types that most people don't think about. So licensed clinical social workers, I will own my bias because I am a licensed clinical social worker. Licensed clinical social workers, we get a master's in social work. In order to become a psychotherapist, we have to do about 3 years of supervision as well as take training in psychotherapy. So often if you're in a hospital setting, you may see someone who's just a social worker, a licensed social worker. They're not able to do necessarily therapy, they can do counseling. But the unique thing with a social worker is the background of social work isn't completely clinical. It is also case management. It is also advocacy. It is also how to get access to resources. It is social justice. So often I find social workers are a very good fit if you can find a clinical social worker as a therapist if you are living with a chronic medical condition, because they kind of have a broader background and often will have training in some of these other areas. The third one you might often hear is LPC, a licensed professional counselor. So these are people who have masters in counseling, psychology, or another related field. Their education is about 2 years, and it is very clinical. Some states will actually not cover insurance if you see an LPC. They don't consider what they call a terminal degree. Basically, they're saying they should have gone on to get a PhD, which is really rude because these people have incredible clinical training, sometimes even better clinical training than some of the other specialties, because that is what they're focusing on. You will also often see like an art therapist or maybe a movement therapist may also be an LPC so that they can do both therapy as well as the creative art therapy with you. The fourth one is an LMFT, which is a licensed licensed marital family therapist. There we go. They also have a master's, so it's similar to an LPC, but their focus is a little bit more on marital and family therapy. But all 4 of these are adept and capable and competent at doing therapy. What really is going to make the difference in figuring out kind of which one you might want is what are their approaches? What are their specialties? Also, do you like them? Do you like their personality? Because if you don't get along with a therapist, research has shown that the biggest predictor of therapy working out is the relationship between the therapist and their client. So you really kind of want to get along and like your therapist. But so when we're saying mental health or we're saying psychology, keep in mind, you've got these 3 other groups of professionals that are just as competent and capable. And often if you get a list from your insurance company, they will be listed. But again, everyone's tendency is like, oh, I want to go to a doctor, And that's the thing too. Most psychologists will say, call me doctor. Most social workers, most LPCs were like, hey, call me Jackie, because we're very casual about it. But any of them are competent. If you need medication, none of those can prescribe medication. And again, within this context, sometimes you may need medication. If the symptoms are really severe, go with depression. If you really just experience a severe depression, you don't want to get up, you don't want to eat, you're really just not wanting to do anything. Okay, you may need medication, but you'd still want therapy with the medication. But for medication to be prescribed, you would need to see a psychiatrist, a child or adolescent psychiatrist, if we're talking about a child. A neuropsychologist can prescribe it. A psychiatric nurse practitioner can prescribe. Sometimes your primary care doctor may be willing to prescribe. Sometimes your mito doctor may be willing to prescribe. My caution always is, if you're doing medication, encourage your doctors to please speak with your mito team. And again, I know there's been challenges, and we know that most of the medicines that we thought were toxic are not really necessarily toxic, and we have to weigh the pros and cons, but you really want that coordination of care. In choosing a therapist also, I would love to say you can go to a therapist and say, hi, have you ever worked with anyone with LHON? Okay, the probability of that is not huge. It just isn't. Okay, so have you worked with anybody with visual impairments? If you haven't, are you willing to learn? If they are not willing to learn, but again, because we're talking about rare diseases, we're not often going to find somebody who specializes or has a lot of experience. Though actually I have worked with one mito patient in my private practice, which is, again, really kind of rare, but I did. So we've kind of got the 4 established. Now, some of the reasons that people will say they're not going to go to therapy, and I know often our doctors will say, see a therapist. Okay, now we know what the therapists are. Okay, how do I find one? If you're lucky enough to be at a clinic that maybe has a therapist on staff or a social worker or someone who checks in with you, that's great. But that's often in the children's hospitals. So how do you find one? In the handout that is attached in the app, I will encourage you, I did list a bunch of resources, ways that you can actually access and find different therapists. Several of them are directories. Within the directories, they will list the specialties, they will list their modalities. Now, the interesting thing in terms of like that accessibility is telehealth. So COVID really brought telemental health to the forefront. Many of us who've been working with the medical population, we've been doing telemental health for years because, again, it's easy. Not everyone can drive to an appointment. You might have other appointments. Nobody wants to go see 5 doctors. Great, I'll just log in and I can talk with you. So much easier. So it's much more accessible, but with that, a therapist has to be licensed in the state where you live, not where they live. They can live, you have to be in the state where they're licensed. So I could see somebody right now, even though I'm in Ohio, who's in New Jersey, and I'd be fine. But it is up to the therapist to know this, not you. But with telemental health, there is expansion, and there is actually right now advocacy within the different groups. So the American Psychological Association, the National Board of Clinical Counselors, NASW, we are all lobbying in order to have reciprocity across states, because again, with something like LHON, what if there is a therapist out there who has experience with LHON, but they live in Alaska? Shouldn't they be able to work with somebody who is living in New York? That is what we're trying to advocate for, because sometimes we're not going to find a specialist who can do what we need them to do within the location where we are. So we're really trying to work on that. And in terms of the virtual piece, research has shown virtual therapy is just as effective as in-person therapy. There are very few situations where we would advise not to do virtual, but it shouldn't be a reason to not go. Virtual is great for most people. The other part then would be how to find one. I really encourage most people, contact your insurance, get a list from them, because ideally if you can stay within your insurance, obviously it's going to save you money. There is a myth that good therapists do not take insurance, that they are out of pocket and you have to pay privately. That is a myth, because if not, I'm going to take it personally. I believe in taking insurance because it's expensive. And I think it's important. Mental health carries over, as we just realized, into every area of our life. Work, social, everything. It should be accessible. So there are so many therapists who do take insurance, but contact your insurance company and they will give you a list. But if you go onto these directories that'll be in the handout, they will also say if they take insurance, which insurances they take, if they don't, what their fees are. A lot of therapists will also do sliding scale fees to make it more accessible. So now we've kind of hit that accessibility, we've hit the financial piece, the resources. So one directory that I kind of want to really bring attention to you guys would be that there's something called Find Empathy. And I found this fascinating. I found it while I was doing research for this. So her name is Dr. Megan Baer. And she is in Maryland. She's a psychologist, and her work was done with people with multiple sclerosis. But what she found was obviously there was a high level of mental health issues with a chronic medical population. And there's no database for therapists who specialize with medical. So she created a database. So it is very new and it's a small platform, but if you go on and you type in visual impairment, any therapist who is now registered with that site will come up, and you will know that they have experience in working with people with visual impairment and vision loss. It's very new, it's small, but it's definitely worth looking at. I can see my name is now added onto it. The other two that I want to mention, kind of without you guys going to the handouts, would be betterhelp.com, which probably a lot of you have heard of. There's advertisements out for it. It actually is a great online platform if you're really finding it hard to find a therapist. It's an online platform. And again, I think it can work well within this community because it is going through a platform. Insurance will cover forms of therapy that they wouldn't necessarily. So often insurance won't cover a phone call or a text message or an email. They consider that asynchronous. They want therapy to be basically face-to-face, even if it's video. If you go through betterhelp.com, they get around that. So if it is easier for you to do a different form of communication, they can connect you to a therapist. The other one is Talkiatry. It is really hard to find psychiatrists. It is really hard to find psychiatrists who take insurance. This is an online platform that will connect you to psychiatrists within your insurance. So if you are finding that you do need medication, this is a great resource that you can tap into. So hopefully I've kind of explained kind of in general that overall view of why mental health is important and what it means within and for the LHON community, but more importantly, how do you know what kind of therapist to seek and what kind of therapy to seek? But again, thank you guys so much for your attention and your time.
Thank you so much, Jackie. That was amazing. So much information. And there is a handout in the app underneath the 4 o'clock session that you can tap into with the resources that she's talking about. We do have a second speaker, but we're just checking on the whereabouts. So hang tight, Jackie, because we may be able to open up to a big old Q&A session. He was flying in this afternoon, so if there was a delay at all, there may be a little bit of a glitch there. But until we find that out, if you have any questions, mic runners, if anyone wants to ask Jackie anything until we get some news, please feel free.
Hi, thank you for all of that. I'm Charlie Hobbs from Minnesota. One of the most difficult things for me since the onset of LHON about 5 years ago, and I'll bet there's people that can relate to this, is not being able to see faces anymore. I guess I just wonder if you might speak to that a bit, because that's such a loss that it's hard for me to even articulate, you know, what it means in human interactions to see faces versus, you know, not. Thank you.
I think that is one of the most devastating pieces of dealing with LHON. I think it's interesting when I was talking to Maria about this, with what my son has with retinitis pigmentosa, the vision loss is opposite. So he can actually see the things that you guys can't, and you guys can see what he can't. So it's really kind of interesting as I was kind of shifting that perspective. But it is a devastating loss because faces we look at eyes, we look at facial expressions. And that's actually even something to consider with a therapist, because if they're expecting you to make eye contact and they're using that as a way to kind of judge, because it is one of the things we think about, oh, you know, are you making eye contact? They need to be aware, no, I'm not going to be making eye contact. You know, my son, he can't move his eyes. He's not making eye contact with anything at this point, but knowing that, but this would go under one of those losses where, again, allowing ourselves to grieve. There really isn't another way to see a face. Yes, we can touch, we can get an idea, but it's not the same. It's not the same as if you're walking into a room and you're recognizing people. So again, you can adapt and accommodate, you can recognize voices, but there is definitely something lost. And again, that's why I say never to dismiss someone's feelings. That is something to grieve.
Thank you so, so much.
My
Thank
pleasure.
you, guys. That was wonderful.
Thank you, guys.
All right, well, it seems that our second speaker was delayed, possibly, in getting to Cleveland. So we are gonna wrap it up for today.